Okay, so in case you have started and in case you're facing any problems, we have a WhatsApp group where people get to motivate each other and ask whatever questions they have, then they get answered. But I hope that we have started the module 1 and we'll wait for the others to join. So I'll just like us to get into, I'll try and share my screen, hoping that you can see it. Thank you, Panina. So my screen is visible and we'll begin. So we are doing quality rights in mental health, and basically before we do anything else, it's good to know what the human rights we're talking about, because there's a lot of controversy that is going around what human rights are, and in some places it's quite different. There's some countries that have not ratified the UN conventions for the CRPDs, and all that is what we're going to have to discuss today. So as we move on, the idea of human rights, as you can see, it's that no matter where you are coming from, no matter who you are, we are all born and we are entitled to the same basic rights and freedom. This is not always the case in most countries, because countries have their different ways that they get to ratify these different rights, and also how they get to input them into their constitutions. Now, I don't know a situation in your country or where you're coming from, but I'd just like to know, how have you seen people with mental health conditions being treated? How have you seen different people interacting with people with mental illnesses? And I know that you have different experiences. Maybe you can write on the chat on how you've seen them experience, maybe with just one word, how you've watched it, people treating them, or how they get to interact with people, how people get to have a lot of stigma and discrimination for the people with mental health conditions. So, well, it might sound that human rights are things that people, they are universal, but then the different countries have to ratify the human rights into their constitution for it to be practiced. And in this case, we'll look at other countries and different scenarios where the countries have not really, the countries or the governments are the ones that are perpetrating the abuse for the human rights in the different countries. So some of the things that we need to note about the human rights is they have some core principles, and one of them is fairness towards all human beings, despite the age, despite the gender, despite their all the other sectors are human. Just the fact that they are human being, they have these human rights. There's equality, there's dignity, and there's freedom for all. But someone will ask me, what if there's a country that has a policy or that has a law or the constitution states otherwise? What is it that you need to do about this? The United Nations does not really have, it has countries that have signed in different treaties, but then it does not really, it ensures that it enforces these things, but it cannot implement the various human rights situations in these different countries. So that is how limited at times the UN is. So who defends the human rights? We have different people that defend human rights. We have the UN Office, the High Commission of Human Rights, which usually investigates the human situations within different countries. And we also have the NGOs and the advocacy groups. We know the most common one is Amnesty International. We have Human Rights Watch, and then we have the governments, but the governments are not human rights advocates. However, when they agree to promote and they sign up in the United Nations declarations, then they say yes to the protection of their citizens in the different countries. We have communities. Communities, like an example that I put there is during Martin Luther King Jr., when there was the African American civil rights movement and this continued struggle for the equal rights, the people marched in a nonviolent protest, and this resulted into the Civil Rights Act of 1964. Also, there's the fact that each and every one of us at an individual level can defend the human rights. So you do not have to wait for the big organizations. You do not have to wait for United Nations. You do not have to wait for Amnesty International to come in. But you at a personal level can stand up and say, no, this is not right. This person is not being treated right. And they can be protected by you speaking out for them. Now, I want you to think about a person who has maybe, say, schizophrenia, for example. And so they are they're functioning, they have been on medication for quite a long time, they are functioning well, as I've stated. But then it comes to a point when you find them, like we had examples in Kenya, where people were being beaten because they had symptoms of schizophrenia. So they are called wendawazimu in Kenya, which means like a madman or a crazy man. And they were really beaten, and there are places where you even find them being taken to institutions, and the institutions are not really defending their human rights as a person. They have very inhumane treatments. They face a lot of discrimination in the communities. And the next place is for them to be taken even to prisons because they have done different things. And that is because they have this point of vulnerability, and that's where I'm heading to. We have segments of populations that are more vulnerable. And by vulnerability, it doesn't mean that they are weak or that they deficient, but it means that they're at a very high risk of their human rights violations. And some of the examples that we stated there are the women and children, we have the refugees, we have the indigenous people. And an example for the refugees is the fact that at times they do not have the papers or the documentation, and therefore at times are considered stateless, and they're unable to, because they're unable to produce the documents, then their human rights can be violated. We have indigenous people, even the mere fact that they're being told, you know, do not speak your local language. You have to speak either English or Swahili, or you have to speak this other language, just makes the indigenous people have their right. Because, I mean, this is the language that they've been speaking from birth until this point. Then you have to now tell them to unlearn or relearn other things and all that. That is the basic, because they have a freedom of speech. They can choose to speak a language that they are comfortable with. And then we also have the people who are lesbian, gay, bisexual, transgender, intersex, a topic of discussion that is right now really, really something that is very big. We also have people with people living with HIV and AIDS. And with people living with HIV and AIDS, we have moments when they're told to produce papers about their medical conditions. In some, even big organizations, they're told that they need to produce papers. And once they are found to be suffering from HIV, then they can even lose the employment or they can be dismissed. And these are cases that we have seen a lot in different places. Did you know that the constitution in some countries states clearly that if you are of unsound mind, you can lose your property, or you can lose even an example. I'm from Kenya, so in Kenya we have a place where it says for any person who's running for a political seat, you have to be of sound mind, and you can lose even your presidency because you are of unsound mind. But what does it mean to be of unsound mind? That is what we are going to be looking at, because someone might be having a psychosocial stressor going on, someone might be having a mental health condition, someone might be having even different conditions, like say bipolar. Does it mean that I can't vie for a political seat because I have bipolar? And the constitutions really states clearly that if you are of unsound mind, then these are some of the things that you can't do. And the other part is the right to vote, the right to work. Employers refuse to employ people with psychosocial disabilities. The rights to education. Some countries do not have the education system that can accommodate these people. There's the right not to be subjected to cruel, inhumane, and degrading treatments. We've had instances where people really had a lot of inhuman treatment that went on, and they were even reported. Some went unreported because the community said they were violent, and so they had to do that. There was no other option. So all these are rights that people get to be denied by virtue of them having a psychosocial or intellectual disability. Also, one that is very critical is that you can even file for a divorce if your wife or your spouse is of unsound mind. And so you'll find people even trying to go as far as saying, you know, my wife is of unsound mind, and therefore this. There are people that we've literally seen go into hospitals and admit their relatives and say, you know, because of this land that we have at home, we are going to make sure that he stays in the hospital and is treated and is well, and we can see what we can do when they get back home. But in real sense, they are denying them the chance to decide, or they are trying to steal that land from them. And we've seen lots of cases where the patient, once they are doing well and they're recovering and they go back home, they come back and report and say, you know, when I went back from my admission, when I went back, when I was discharged, I went and found out that the land was already taken and there's nothing else that I could do because it was no longer in my name. The title deed was changed and everything else, all while they were in hospital on admission. Now, so this is where Quality Rights in Mental Health initiative comes in. It comes at a point where you have realized that, sorry, hi, Josephat, kindly mute. Thank you. Okay, so Quality Rights in Mental Health is coming in because there's been a dire need for people to ensure that we protect, or we become the voices for the people who do not have the voice. For example, there are times when patients jump off a wall in Mathare and it's reported in the news and it's a whole so for those who do not know Mathare, Mathare is a psychiatric facility in Kenya, and it's the largest public psychiatric facility that has over thousands of patients, inpatients and outpatients. So there are moments when we have patients at times jumping over the wall and running away, but then the news brings it out differently, and also people have different views about it. But one thing that is quite important is there are times when you see someone jump, or when something like that happens, there's a lot of beating that happens from the community. At times they get to give them a beating, like they take strokes and they strike them that they're running away, or they go and hold on to them and they put them down and they want to beat them. There are so many patients that come into facilities and they say because they were aggressive, we have to calm them down. And so they come with lots of shackles in their legs. They have shackles in their legs. They have all these things tied around their hands, and they have no say. They cannot say anything. When they say, you know, these guys are the ones who have been making it tough for me. I do not, I'm not sick. I am very well. It's my family that is stressing me up. They say, no, you see, he's speaking like a madman. That's why we're bringing him here, because he's aggressive and he's becoming violent and he's telling all lies. Until you realize that after you talk to them, it's true that their relatives were really calling them mad. And so they were not lying. And other than calling them mad, they wanted to bring them in because they wanted to fight them back, and they called that violent. Now imagine if it were you who was the sick person and you are brought in shackles, your hands are tied, your legs are tied, and you have nothing to say. If it were you, how would you feel about that? Or even if you were told that that ever happened to you, would you be really happy that you are tied like that as a patient? Do we ever get to tie patients who are suffering from diabetes? Do we tie up patients who are suffering from hypertension or these other illnesses? Or are the illnesses quite different from patients who are having mental health conditions? And that is why Quality Rights is coming in here. Now, let's look at some of the things that the content of the training has, because today we are doing an introductory into quality rights into mental health. And by 8:30, I think we should be getting questions and getting done with this introductory module. The first part, we're looking at human rights, basically, as I have said, and also the Convention for the Rights of Persons with Disabilities. We are moving from talking about just mental illness, but we are considering people who have psychosocial, people who have cognitive and intellectual disabilities. So it's a whole umbrella of all those mental health conditions together. Then we'll also look at mental health, disability, and human rights, the fact that there are some of the mental illnesses that really create disability. And according to the DALIS research that was found out, it found out that most people who are suffering from severe schizophrenia, they're unable to be productive in their communities and even for themselves. And therefore, that is something that is considered something that is considered a disability, and therefore they, even in the disability adjusted life years, they are meant to be registered under people with disabilities. That's why we are calling it psychosocial disabilities. We will talk about recovery and the right to health in mental health and social services. And also we'll talk about the legal capacity, the right to decide in mental health and social services. Is it right to put medicine in someone's food for them to eat the medicine in the food if they do not want to take the medicine? Or how else will you ensure that they take the medicine without hiding it in their food? We will look at mental health and social services free from coercion, violence, and abuse. And at the end of this, I am hoping that all of us who are coming in here are going to have a changed mindset about how to deal with the patients or the clients who are having psychosocial, cognitive, and intellectual disabilities. And we'll be able to be the change. When you see someone tied in shackles, you can tell them, no, let's do a de-escalation technique. So we'll also even talk about de-escalation techniques and how to de-escalate the situation, how to ensure that the patient's not only rights are protected, but also their physical well-being is protected. And at the end of the 6 months, for those who will be going through 6 months, this is a course that you can do within 1 week. But then because we want to encourage each other and also to get to make sure that we all understand and can do it thoroughly, we are doing like the 6 months challenge. At the end of it, you'll get your certificates and there'll be a graduation. And that will mark like we being the mental health champions in our communities. The objectives of Quality Rights is to improve quality care and human rights in inpatient and outpatient mental health services. Also provide a community-based recovery-oriented services that respects and promote human rights. We also want to ensure that we reform national policies through engaging with the government and the government quality rights. Most of this also was we are trying to ensure that we bring in from the World Health Organization and also from the ministry's perspective of what quality rights in mental health entails. So the main aim is to promote the rights of persons with mental health conditions and to improve access to good quality mental health services. There's a report that was done by the Task Force on Mental Health in 2019. And according to the report, it showed that most of the public hospitals in Kenya had the same structure as prison setups. So we have like a very small, we have things called seclusion rooms, and we'll talk about why there's need to get rid of seclusion rooms and instead use the escalation techniques while dealing with people, especially those who have having psychotic symptoms, extreme psychotic symptoms. The Quality Rights also works towards ensuring that people with mental health conditions enjoy basic human rights, as well as those that are derived from the conventions on the rights of persons with disabilities. Now, the 5 themes from the CRPD articles are, number 1, freedom from torture or cruel, inhuman, humiliating treatment or punishment. The one I'm talking about, beating the patients or even mistreating the patients or the clients or anyone that is suffering from mental health condition. Also, adequate standards of living and social protection, enjoyment of highest standard of physical and mental health capacity, and the right to legal capacity. Sometimes they don't get represented in the courts or in the legal frameworks. They'll say, well, we're going to tell them they're not competent to stand trial. And so they are taken into back and forth. They're not competent to face the trial. And all this while, some people are trying to get in the way and tell them, you have to pay this amount. You committed this crime. Just give us this amount and we will let it go. We will let this case slide. But then how else can we ensure that their right to legal capacity, they do not lose their property just because they were sick? How can we ensure that they do not they do not file for cases for such people just by virtue that they cannot sign the document when they are in the right state of mind? We'll also look at living independently and being included in the community. We'll look at the Article 25. Let's start with this. And it means that we ensure that there's access to mental and physical health services on equal basis with the same standard of services as other people. Not that we say, okay, these are mental health patients, let's put them on this side, these are other patients, let's put them on this side. The same services that these patients are getting are the same services that these other patients are getting. There should not be discrimination on that. And I already mentioned how some of the facilities are. And the one of the findings that was also there was that the mental health facilities other than being buildings that were dilapidated in bad conditions, they were also very close to the morgues. You can imagine. We'll also look at still on promoting mental health and well-being, improving standards of care in mental health facilities and services. The right to legal capacity, how we can have supported decision-making instead of substitute decision-making. Most times when you go to the hospital, you'll ask, okay, so who's bringing them in? Do you use this medicine? It's the other person, it's the relative that is answering the questions. Yes, he does not use this medication. Do we get to admit them? Please, yes, admit them because they're very violent. And the patient is then looking at them and saying, don't admit me. Then you say, you see, they're mad. That's why they don't want to be admitted. They don't want help. But in real sense, they might be saying, don't admit me because they know back home, their property is going to be stolen, or their property is going to be taken, or they're the ones that made the conditions hard for them. So sometimes it's very good that while they are still not having a crisis, you get to have an advanced plan with them. And we look at the advanced plans. How do you get to have an advanced plan for someone who's having a psychosocial disability? You get to write it down with them. When I get sick, this is the doctor that I want to see. This is the medicine that I get reactions from. This is the allergic reactions that I get when I have this medication. This is my hospital of choice. This is my insurance card that I have, so that in case there's anything or they're having a crisis, the advanced plans is there, and this can be taken, and they can be their rights are still going to be upheld instead of someone else making this decision on their behalf. And that is something that when I first did this course, I loved it because I never thought about it like that. But then after doing this course, I was like, wow, it's actually very important to do this, because God forbid, if I got sick today and someone else took me to the hospital and was making all the decisions for me, I would not like it when I am on medication and I'm already better. And I'm like, what decision did you make? Why did you do that? But because I am able to make the decision at this point, I can make my advanced plans. And in case of anything, then that can be used for me. Additionally, we'll look at how clients, the users are made aware of their rights. So if you're a user of service, then you can have this and this done and all of it together. So ensure that there's adequate standard of living and social protection. So right to housing, social protection, human rights are what no one can take away from you. But in some cases, we have people who are the perpetrators and people who really make it hard for them to undergo this. So I am going to finish up with the last part, and I'm going to be taking any questions in case there's any, because we say this is just an introduction to what human rights is and why we are looking at the Convention on the Rights of Persons with Disabilities, and why the UN Declaration on Human Rights is also important while dealing with mental health, because you have to look at all this vulnerability that this person has and ensure that their rights as a human being is not compromised by the fact that they are sick or by the fact that they're having a mental health condition. So we have freedom from torture. In case you have any question, just write it down on the chat so that I can take it and we can get to ask it in the next 5 or 10 minutes. So there's involuntary sterilization, pregnancies or abortions. We have cases where people have gone to the hospital, and even at times in healthcare facilities, they said, okay, we'll have to have an abortion for this child. We'll have to do this involuntary sterilization so that they no longer get pregnant because they cannot take care of the child. And they made the decision on behalf of the person because the person is unable to make the decision for themselves at that point. Imagine someone having to give you a permanent method of family planning just because you are not in the right state of mind at that point when the decision was being made. So unfair. And that's why we are talking about this Quality Rights in Mental Health initiative and how better we can ensure that we protect these people who might be going through such abuse of their human rights. We also have this final part: avoid isolations, chaining and restraining of clients, economic violence and coercion, controlling of persons' resources to force the person to do things or do what they do not want to do. So all these things become part of why we need to advocate for the rights for persons with psychosocial disabilities. And I'm hoping that at the end of the 6 months or at the end of the time when you're going to be doing this training, you'll have learned so much, and not only learning through the writing that you're going to be doing, but also going to implement it when you go back home. I know we are from different nationalities, and I'm hoping that you're not just going to be learning in books and that's the end of it, because that will be such a waste. But you are going to become an advocate in your community, telling people, no, don't treat them like that. This is a human being, and because they're having this condition, let's seek medication. Let's seek for this thing. Let's not make decision at this point. Let's wait for them to respond to the medication. Finally, I don't know whether there are any questions that I am not seeing, but as we finish, this is how the platform looks like. So it is very interesting. The course is called Foundation in Mental Health, Human Rights and Recovery. And when you get there, you'll first be needed to sign up. So you'll get to sign up, write in your details, put in all the login details. And after you do, it will bring you pop-ups of different tabs. Choose onto the first one that you're going to start with, and that's human rights. And the second one, when you are done, you'll move on to the second one, human rights, disability, and mental health. Like that until the last module, which is module 6. Upon finishing your module 6, then you will have your certificate certified by the World Health Organization. It will come right after you finish. And then you are now able to see yourself on the platform with other people. So for example, I can decide to challenge Vanessa. I say, okay, now I'm going to challenge Vanessa on module 1 so that I see how she's read this module 1. So I'll send her a challenge and she sends it back to me. And then we see who won the challenge. So you can challenge whoever from any country, from different countries that are already on the platform. From whichever country, you can challenge someone, and then you get to see how far you have learned. Then there's peer learning and sharing and coaching. And all this are still on the module. So it is very nice, very practical, and very important for each and every one of us. Finally, I'll finish with this quote, which is very nice. It's from Eleanor Roosevelt. She said, "Where, after all, do universal human rights begin?" She said, "In small places, closer to home, so close and so small that they cannot be seen on any maps of the world. Yet they are the world of an individual person, the neighborhood he lives in, the school, the college he attends, the factory farm, the office he works in. Such are the places where every man, woman, and child seeks equal justice, equal opportunity, equal dignity without discrimination. Unless these rights have meaning there, they have little meaning anywhere. And without concerned citizens' action to uphold them close to home, we shall look in vain for progress in a larger world." So it does start with you. It does start with me. We do not need to wait for the bigger organizations or for the United Nations to say we need to uphold the rights of persons with psychosocial disabilities. We need to stop beating them, because I have never been beaten because I have diabetes. I have never been beaten because I have hypertension. But it's an illness, and like any other illness, I should be treated as a sick person and even help gotten for me. But then we all have to do something in our own capacity to protect the rights of these people so that they do not face the abuse. And up to that point, I'd like to invite us all for module 2, which is happening in May, and that will be human rights, mental health, and disability. Thank you very much. Asanteni sana, and these are our social media handles. You can join us for them next time. So right now we have 100 people. No, we have 93 people registered, and the turn up today was very low. I am surprised, but of course it's been recorded, so we are going to have this shared later on. But in case you are just joining and you have not started the module, please do start the module. Do not miss, so that we can start the challenges very soon. Other plans on why we are doing the Quality Rights in Mental Health Challenge will be shared as we go on, but we intend to have communities that we will be moving, because we have people that are that's registered on the platform from different countries and different communities, and therefore we want to ensure that at least in every country, in every community, there's a quality rights in mental health champion in that country, in that community, and we can all exchange notes from Ghana. I know Prince is here from Ghana. I know Vanessa from Uganda is here. I know different people from different countries are all here. And I'm hoping that at the end, we can have all our communities impacted on this. Any other questions? This is the time. We have only 3 minutes, so I'll take a few questions, then we can head out. Thank you very much. Any questions? Let me try and see on the chat if there's a question. There's none. No questions? No questions mean well understood or confused or
Hi, Flynn, they're actually questions.
oh, Vanessa,
the
Vanessa,
chat.
I can't see them. Where?
In the chat.
Oh, please read it out for me. I can't see.
So the first question is, do the modules have fixed deadlines, or you can do them at any time within the 6 months?
Oh, you can do them at any time within the 6 months. There's no specific deadline for when you need to finish or when you need to start. You can finish, and I stated at the beginning that you can even do them within 1 week and you finish all the modules. But because of the challenge, that's why we said let's do it all together. Yes.
Okay.
Any other
Then
questions?
the second one is, kindly share the link to register the modules.
Okay. I'll share the link here. But there's also a WhatsApp group that you can get to join so that you can get more information. But I'm just sending this link right away so that you can get to register. Any other question, Vanessa?
No, those are the only two I've seen.
Okay. Someone was telling me I can't hear what the host is saying. Vanessa, could you hear me? Did you hear me all through?
Yeah, perfect.
Okay, so if there's no other question, I'm just going to send this link, and thank you all very much for attending session 1. We hope to see you in the next session, and please, you can invite your friends to join in. The sessions are very brief. We just have it as a brief session because you've already done the course. Where can we chat? Okay. So it's just like 30 minutes and that's it. All right. Thank you very much, guys, and do have a lovely night. We will see you next time. I hope you got the link.
Thank you, Flynn.
Bye-bye. Okay.
No, there is no link in the chat. Yeah, we've seen it.
There.
Yeah. Thank you.
Okay. Thank you very much, guys. Have a lovely evening and see you in May.
Okay. Bye-bye.
Okay. Bye.